Did you recently get a Medicare Advantage plan for the first time? Perhaps during this past annual election period or from recently turning 65? If so, you might want to watch this video and learn some things about Medicare Advantage, because odds are you probably weren't told some things that are extremely critical for you to be aware of. And if you enrolled through some 800 number ad that you saw on TV, the internet, social media, or a telemarketer, then you might be in trouble. In this video, I'm going to unveil the 7 most important things you need to know about your new Medicare Advantage plan. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in numerous other states as well. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. George Burns said, "I was brought up to respect my elders, so now I don't have anybody to respect." So number one thing you need to know about Medicare Advantage: it is not Original Medicare. It is an alternative to Original Medicare. It is overseen by CMS and Congress, but it is not the same as Original Medicare. It is administered through a private insurance company. It is not a Medigap or a secondary policy. It does not pay after Original Medicare. It is the primary payer in most cases, and then you are secondary. And if you had or have a Medicare supplement, then it doesn't work or help with Medicare Advantage. Let me give you a couple examples. One was a lady several years ago that I had met with, and she had a drug plan and she had a supplement. I went over everything with her. I said, let's keep the supplement. She got that from somebody else, and we found her a better drug plan. I enrolled her into that. The next annual election period rolls around. We reviewed everything again. She needed to change her drug plan, so we changed the drug plan. Well, before the end of the year, I had noticed that she had dropped her new drug plan before it even started. At that time, Medicare had a wonderful rule that as an agent, even for my client, if they drop a plan, I can't contact them. Thankfully, they have changed that. So about 6 months later, in June of that year, she finally called me and started explaining what had happened, what was going on, and basically she was telling me that she was getting all these bills from the providers and her supplement wasn't paying anything. Of course, I knew what happened, so I asked her what she did, and she called up an 800 number ad or answered the phone, and they enrolled her in a plan, not only a Medicare Advantage plan, but like the worst one you could possibly get, where her providers weren't even in the network. And they did not tell her, of course, that her Medicare supplement wouldn't work. 6 months later, that June, I told her, I said, get off the phone with me, call up Medicare, ask for a supervisor, tell them that you were hoodwinked and misled about the Medicare Advantage plan and your Medicare supplement, and ask them to reinstate your drug plan that I enrolled you in, retroactive all the way back to January 1st, and to terminate that Medicare Advantage plan. And then once they do that, go back to all your providers and tell them to rebill Medicare and rebill your supplement. And she did that. When I met with her the next time, which was about a year and a half later, she was still having some issues. And when I met with her just a little bit over a month ago, there were still a couple lingering issues from something almost 3 years ago, because she picked up the phone or somebody called her and she rolled in a Medicare Advantage plan without knowing how it works and about her Medicare supplement. Another example, pretty similar. I had a client that's been with me since 2010. The last time I enrolled her in anything was with a Mutual Omaha Medicare Supplement Plan G and a Humana drug plan. A year ago, I noticed that the drug plan had dropped, but the supplement was still going. So I didn't contact her, figuring she just changed her drug plan. Well, a little bit over a month ago, she calls me in a panic, telling me that her Mutual Omaha is not paying claims and she's got this Humana thing. And before I called her back, I knew what was going on. But before I called her back, she picked up the phone and she called Mutual Omaha to cancel her supplement. So I called Mutual Omaha, made sure it wasn't actually canceled, called her up, asked some questions. Lo and behold, she called an 800 number. They didn't tell her that the Medicare supplement does not work with Medicare Advantage. And this poor lady has been paying a premium of $273 per month for the last 12 months that she couldn't benefit from. Unfortunately, she has come down with cancer. So what I have done is I've got her a new drug plan which terminated the Medicare Advantage plan because she didn't drop her supplement. Thankfully, starting in January, it will be paying as well as Original Medicare, and then she won't have any co-payments as she goes through cancer treatment. So those are just a couple examples, a couple of horror stories. The number 2 thing you need to be aware of is prescription coverage varies widely with Medicare Advantage plans. Do you know for sure that you got a plan that is on the low end for prescription costs? Did you or whoever sold you the plan do a cost comparison for you? Always look for a plan that is on the low end of prescription costs. Number 3, you don't have access to as many doctors as you do with Original Medicare. Did you make sure that all of your doctors are in the plan's networks, or that you can go out of network at the same cost as in network? Were you told that doctors and hospitals can leave the plan's network at any time? You may be locked in for a year, but the provider can go in the middle of the year. If you got an HMO, were you informed that the majority of specialty hospitals don't accept them? Number 4, your financial risk exposure could be really high. This is called the maximum out-of-pocket, and they typically range from $3,000 to $8,000, sometimes less, but in most cases they are in that range. By the way, if you're finding this video helpful and don't want to miss other great content about understanding the pros and cons of your different Medicare options, then please consider subscribing. It is greatly appreciated. Number 5, your Medicare Advantage plan will require more prior authorizations than Original Medicare for certain services and procedures, and can deny services and claims in cases where Original Medicare and a Medicare supplement would not have. Number 6, extra benefits are nice, but they are not why you choose a Medicare Advantage plan. But if you got them, find out what they are and use them. Unfortunately, the ads and the people you talk to on the phone, all they do is push the extra benefits. And number 7, calling an 800 number you saw on TV, the internet, social media, or a direct mail letter is putting your healthcare coverage in peril. I'm not talking about other agents on YouTube. I'm talking about the big brokerage, publicly traded companies that constantly run ads on TV. Most of these telesales agents lack years of experience and focus primarily on Medicare Advantage plans and only on some of them. They don't give you full disclosure of all your Medicare plan options. So now that you are armed with that info, what can you do? If you just signed up for a plan during the annual election period, then you can make one change during your open enrollment from January 1st to March 31st. You can either switch from your Medicare Advantage plan to one that suits you and your unique needs better, or you can drop it and return to Original Medicare, get a Part D plan, and then maybe a Medicare supplement. If you had a Medicare supplement and you want it back, then as long as this was your first Medicare Advantage plan, you have a 12-month trial period where you can get your supplement back guaranteed. If you are new to Medicare, like you turned 65 recently and you chose a Medicare Advantage plan instead of a supplement, and now you want to change your mind, then if you want a Medicare supplement instead, you can do so within your 12-month trial period guaranteed. If you want another Medicare Advantage plan, then you are stuck until your annual election period in the fall, unless you qualify for a special election period like you're on Medicaid, Social Security Extra Help, or you have moved out of the plan's area. What if you know everything I've just revealed and you are happy with your choice? Congratulations! Then 1, maximize your benefits. 2, contact me in the fall. 3, pay attention to Medicare Advantage news. You can subscribe to my channel to stay up to date about news related to Medicare Advantage. And 4, watch some of my previous videos like Should You Be Scared of Medicare Advantage and the 3 main risks with Medicare Advantage. Survey! Would you be willing to help me out and participate in a short 15-question Medicare Advantage survey? If so, and you currently have a Medicare Advantage plan, please see the link in the description to participate. I do not ask for any personal identifying information other than the state you reside. No name, no email address, no phone number. Once the survey is completed, I'll do a video on the results. And if you would like my help with this, or if you ever need help making a wise choice when it comes to all your Medicare insurance options, and you live in one of the states that I'm licensed in, then please feel free to reach out to me either by phone or through one of my contact forms on my website. And if you happen to live near the Charlottesville, Virginia area with an hour to an hour and a half, and you would like to meet in person, then please reach out to me and we can probably work that out. If you have a question, then please put it in the comment section below. And if you don't mind, please let me know what state that you are watching from. That's it for today. If you want more insight on the pros and cons of your Medicare insurance, then please remember to like, subscribe, and share. I'm Chris Prang, Medicare analyst. Make it a great day.